Beth. Go ahead.
Hello, everyone, and welcome back to Unfiltered Vet Discussions. We love having you here. We love having you here so much. We'd like you to come back. So please hit the subscribe button or follow button or like button or heart button, whatever social media or podcast platform you're on, whatever way that you get a notice that there's a new drop, we want you to push that button. So come talk to us. And then, of course, we'll see you at major conventions this year when we're there. So today's topic is you cannot manage time, you cannot buy time, but you can manage yourself. And I'm going to throw this over to Peter because Peter actually does talk about this in quite a different few places in person. So you may be able to hear him have us talk about this at a convention near you. So Peter, what's a great way to like segue into this conversation?
Well, I do want to touch wave.
Oh
Hello.
yeah, we
Yeah,
forgot to
wait.
wave.
Yeah,
And you
Oh,
can find us
fail.
on all of the platforms that you want to listen to. So it is interesting that you're talking about people coming back to hear us.
right.
And the way that they need to do that is they need to find the time to do
Ooh,
so
Mm,
ooh, nice,
nice
nice,
by,
segue. It's good.
nice,
you
nice.
think you like that? Do I get
Yeah,
a
that was
It's
good.
good. It's
That was
yeah,
good.
good.
thank you. Because we have a limited amount of time. And I don't know if it was on our last call, but I've been talking to people about as you get older, it feels like time flies so much faster. And so it is finding the time because there's only a limited amount of time. There's 60 seconds in an hour, 24 hours in a day, excuse me, 60 seconds in a minute, 60 minutes in an hour, 24 hours in a day, 7 days a week. And so every one of those minutes, every one of those seconds is occupied with something. And if we look at time motion studies for ourselves, let's just say we're getting 7 hours of sleep. All right. Beth, you're probably working from 7 a.m. to 7 p.m. in some capacity between the time you're getting ready to go to work, getting to work, and then getting home. So you're probably spending 10 hours is as Dr. Beth. Then there's Mama Beth,
Mm,
and then there's Beth.
mm,
Same thing for you, Kelly.
Mhm.
So we really need to look at who we are, what we do, and then learn how to prioritize our time so that we can get the greatest result of the utilization of our time. And so when I talk about time, it's talking about prioritization of time and learning how to prioritize or triage. If we're looking at it from a veterinary standpoint, it's triaging your time and putting in time for you throughout that whole thing. So I'm going to stop there for just a minute because it really started with Beth bringing to the fore some concerns that she was seeing in young doctors, which is probably a global concern, but that Beth is seeing in doctors in her own practice.
Yeah, so I brought this up because I definitely see, and honestly, I feel like it's to some extent all of us, all doctors, and even all the support staff in the hospital, when there's so much to do and you have the phone ringing, people asking you questions, your call list, you have to get back to, the patient that's standing in front of you, the patient that's in the hospital, your next patient, all of those things are like bombarding you. And it's very hard to know in what order of operations to do things to be the most efficient that you can be. And I brought this up because I have definitely noticed, and it's something I've chatted about specifically in my one-on-ones with my younger veterinarians, that it's really hard when you have a day that doesn't go exactly according to plan to not get behind because you get gummed up by that patient that came in as like ADR and now you're like, oh my God, its gums are white and it's really pale and it's sick and I need to do blood work and they should wait because this might be urgent. But now, instead of that appointment taking 30 minutes, it's like sucking them into this vortex of like trying to help this person and trying to help this patient. And now all of the other scheduled appointments are like an hour behind. And I feel like this is a universal problem, like Peter said. Like, this is definitely something you learn as you go as a veterinarian, like how to juggle between that appointment and the other waiting appointments and the calls and all the other things that are happening, that's really, really hard. It is so hard to do. And I feel like even though my younger vets have absolutely improved and they like learn as they go, it's still something that we're seeing right now. Like I was talking about yesterday, my poor associate was like over an hour behind because her very first appointment was super sick. And I just felt like it was a good topic because it's something that we struggle with. And when you're in it, it's hard sometimes to see the big picture of like, okay, maybe they should just leave this animal for 3 hours so I can like move on and call them when I have a minute instead of going in and out of that appointment every time I have new information. Or is this animal stable that they can take it home and bring it back tomorrow as a day case? And like making those decisions on the fly is really hard.
Well, and Kelly, nothing dies in your business like it does in Beth's. Nothing dies in my business except for me. So
You're looking really
you,
good for being dead, Peter. I gotta
I
say.
appreciate that.
Yeah,
But I think it is, you still have prioritization that you have to go through
every day.
based upon phone calls, sales, changes that are happening within your industry, et cetera.
Well, speaking of death too, with some of our clients, I mean, over the years, we've had a few of our clients lose the owner or lose a prominent doctor, right? And then if it's in a small town, we have to shift really quickly to help that client because they're hurting, right? Because nobody was planning on that death. Or how do we get the word out to their clients that Dr. So and so is no longer with us, but we're still seeing your animals, like, that coordination. So then that shifts your whole day, like, because you weren't planning on that, but we're here to help, right? Just like you guys come in with a sick animal, you're here to help. So it does happen, not as often.
Okay, so here's something to visualize because, or they probably could do a screen share on it, but um, it's called the Covey matrix or the Eisenhower matrix. And on the x-axis is urgent or not urgent. The y-axis is not important or important. And you now have four quadrants. And you have a quadrant that's not important and not urgent. What do you do with those? Not important and not urgent.
They should wait.
Thank
That
you.
should be at the bottom of the list.
Low priority.
Mhm.
Okay. Now, what if it's urgent and important?
Should be at the very tip top of the list.
Correct. Now, urgent, but not urgent and important. Not urgent.
I guess I would probably put that kind of in the middle.
Okay. So that's planning. That's future.
Yeah.
And then urgent, but not important.
I guess that kind of needs to be in the middle too, or can you delegate it?
Bingo. Bingo. Now, I don't know if you're looking at this on the screen because I
I'm
told you,
not,
but
but I've done this exercise many times.
that's exactly it. And so in the exam room, the doctors have to decide which quadrant the case is in. And once they decide that it is both urgent and important, this pet is circling the drain, that needs to take action immediately. That's crisis mode. Now, your goal as a business manager is to avoid crisis mode. Because the minute you hit crisis mode, all of the systems that you have in place go out the window.
Mhm.
And so, one of the things I do try to teach young doctors, especially, is to stop trying to do inpatient care on an outpatient basis.
Yes, that's the problem. That's the crux of this problem.
And so it is about learning young doctors that hospitalization buys time,
Yep.
metaphorically, because you can't buy time. But hospitalization buys time. So does a stethoscope, because it shuts down the client. What most young docs, theoretically, what
Yeah.
most young doctors need is time to think through or phone a friend, ask the audience, or do a 50-50 who wants to be a millionaire. So it is teaching your doctors how to use this quadrant because everything to a young doctor is urgent and important.
Yes.
What is a GDV? What's a bloat? Urgent and important. What's a broken nail? It's important, but not urgent.
Right.
What's vaccinations? That's delegate. Urgent, not important.
Right.
And again, a lot of it is perception. So, how do we teach people about the perception of case management? It's really having these types of discussions. Which quadrant do they fit into? Do they fit into the do now quadrant? Do they fit into the schedule quadrant? Do they fit into the delegate quadrant? Or do they schedule into the eliminate quadrant?
Yeah.
So, everything that you do with your young doctors, tell them to put it into one of the four quadrants.
Yeah.
And then they know how to act
Yeah.
and help them to do it. Help them to do it.
Yeah, that's a really good way to do it because I've never framed it in that way to them because we've had the conversation of utilizing hospitalization or can this animal come back or can they just be admitted or whatever way to do it that you don't feel like you have to give them all the answers right now, which I recognize is what it is that they feel bad not giving them the answers right now. And I think that teaching them ways to help even break that patient that's in front of them into one of these quadrants is a really good way to frame it to them because I've had multiple conversations where I'm trying to help them, but I like this approach because I use this all the time in my business management. But I feel like I kind of like naturally by just learning over the years utilize it with my patients too, but just sort of naturally through, 10 plus years of practice. But it is a really good way to look at it for them with the patient that's in front of them too, because that's the problem is they panic when it's sick and then treat everything as urgent and important when a lot of them aren't. A lot of them are either urgent and not important or not urgent, not important, but we're treating it like that because the owner thinks it's urgent and important, but maybe it's not. It's a totally stable patient that ultrasound doesn't need to be done right now in between appointments. It could wait and be scheduled tomorrow or even next week if we start them on some supportive care and give them blood work results and blah, blah, blah. So yes, I agree. That is a great way to look at it.
I
So the
think that,
way what we call triage, Kelly calls prioritization.
yeah. Mhm. But it also helps when you're in a crisis to already have that information in your toolbox. Like if you're going over this during a staff meeting and just throw it out there, and then people already know, have it attached to the right quadrant, right? The right decision that when they're in the crisis and they're looking at the pet parent who's like the wheels are off their bus and are emotional and freaking out and having a moment, they go, well, this is not urgent. They can calm the pet parent down and say, Fluffy is not on the deathbed today. The broken nail we can fix. It's okay. We'll get there. It will heal. Sepsis is not going to set in, most likely, and you'll be good to go, right? But if you don't know that information, you're dealing with pet owner who's unhinged, you have no tools in your toolbox to deal. I would understand. I've been the pet owner who's been unhinged, so I'll completely own that.
Yep.
But and I've always appreciated the doctor going, he's not dying. Oh, okay. Well, anything's up from there. I'm willing to listen now. Okay. Right?
Right.
So Beth, think about putting one of these, either the Eisenhower matrix or the Covey matrix next to your whiteboard in the treatment area.
Yeah. I was just
And
thinking that I should print this.
yeah, and then use it as you look have as a nurse every day put each of the cases on the whiteboard into one of the quadrants. Now, you're not going to have not urgent and not important likely in the treatment area unless it's a nail trim.
Right.
That means somebody else can do it. It shouldn't even be on the whiteboard for the doctors. It may be at the
Right.
bottom line. But then I would also probably take a couple of days of appointments that are on the books and look at which quadrants you think based upon the information that you have.
Right.
Because I would guarantee way too many of your doctors are going in on the urgent and important, which is when your heart rate goes up for something
Mm,
that is flea bite allergies.
Right.
It's learning how to um, prioritize, triage the cases in your mind, which comes from experience,
Yeah.
which takes time. Oh, we're back to time, aren't we?
Yes. Yeah. And I see it in my nurses too, because I feel like they care deeply and they want to make sure all the patients are okay. But then sometimes the way that that presents itself is they're panicking about a patient who maybe is like panting and breathing heavier, and then they're interrupting the doctor in the middle of an appointment for something that's not urgent and important, but maybe important but not urgent, or vice versa. And they have a hard time, I think, even sometimes deciding when should I be interrupting the doctor? When is it okay for me to, do some of these other tasks and give the patient a minute versus I need to be just staring at that patient. And then I feel like that affects their time management and ability to get all of their tasks and treatments done on the patients, because sometimes they get like in the weeds about thinking every patient that is behaving ill at all is like urgent and important when some of them are definitely not. And then it's like that trickle down effect of now everything is not getting done efficiently. And now we're here late or we're super stressed out when like we could have maybe taken a step back and reprioritized what needs to happen and then been able to get everything done in a timely manner without feeling as stressed out. But it is hard. Like I recognize it's hard because I was a panicker when I was a young vet. Like I felt like everything was dying, even if it was like flea allergy, dermatitis. And I also felt like I had to always have the answer and I could never say I don't know, or they would think I was an idiot and I had imposter syndrome and didn't know what I was doing. Like, and I recognize that. And I felt that way for like 5 years. It's like a long time. You feel like you don't know what the hell you're doing.
You still have imposter syndrome.
I do. Yes, I do.
We all do.
I
We all do.
definitely shouldn't own a practice and be the leader of 50 plus people because I don't know what I'm doing. But yes, it changes. Your scale changes as you get more experience.
Well, if you live in the urgent and important quadrant, your adrenal glands are constantly getting squeezed. That's called The Pit on HBO.
Yes. Which is a
Okay.
great show, by the way.
Absolutely. And if
Great
you
show.
really want to have fun with your doctors, watch an episode and go through and prioritize the cases that they go through. There was one episode in the last year where somebody was just sunburned. Well, that's important, but not necessarily urgent.
Yeah.
And it's interesting to watch the residents delegate to the students, or delegate to the interns who delegate to the students. And when the doctors who are on shift, the lead doctors, they jump in on the stuff that's urgent and important.
Right.
So it's really um, and the other variable that in veterinary medicine we deal with, Kelly talked about it, is we put people into urgent and important. We put patients into urgent and important based upon the person who owns the pet, because we respond or react to the personality of that person because we don't want to deal with them. So we make it more important than it actually is from that standpoint. So we have a psychological component that goes on to the physiological component that we're dealing with as well. And trying to balance all of these things does take experience, which
Yeah.
takes time.
Yeah. And like fully recognize this is hard. It is really hard to do well. And it is very easy to get bogged down, especially if you have a client who is adamant that their pet is the most important patient in the hospital and is like riding you to get answers and to do all the things, to be able to navigate even how to have that conversation to make the client feel heard and supported while still being able to move on and help all the other patients that are waiting because you've now been with this person for like an hour. Like it's a challenging thing to do. And these are like some of the innuendo situations that I think lead to the high stress and the people feeling burnout at the end of the day of in the team because they are living in that urgent and important quadrant with literally everything that they're doing, and that is a really hard thing to sustain because it's exhausting. Then at the end of the day, you feel like shit because you're exhausted because you spent all day with your cortisol levels like through the freaking roof because you're just panicking about every scenario, which is super hard.
And is there a piece of this before the door opens and patients walk through the door where maybe your baseline matters on how you handle those quadrants and how you deem those quadrants? Because your personal baseline maybe is not at zero, but it's elevated. So then everything else seems elevated. So it skews the quadrants, something maybe in one quadrant because your cortisol levels are already in the red zone makes this everything else go. Right.
Yeah.
And I'm imagining because I don't work in a hospital, I work in a different environment, but I'm just knowing my own self in how I approach my life and my world that if I'm off, my lens of the world, I have to be aware is off, right? It's not normal baseline for Kelly. It's an elevated baseline for Kelly.
Yeah, totally.
What if Kelly, if I call or email your team and I say the website is down, to me, that's urgent and important.
Correct. We all lose our minds and go fix it immediately. Yes.
Correct.
And your cortisol goes through the roof.
It
Correct.
hits Mars at that point.
Right.
Yes.
So you have your own versions of urgent and important. But
Mhm.
if you're building a website, it's important, but as long as you don't set a time frame that is unreasonable,
Correct.
it's not urgent.
Correct.
And so part of the problem we have in veterinary medicine is we don't know how to effing schedule. And so we don't look to put soft landings in between hard takeoffs. And so what we can end up having is back-to-back adrenal squeezing cases when we need a puppy in between
Hmm.
or a kitten in between. And so for me, if I look at the appointment book for the next day before I leave, which is the worst thing I can do, but I did, and I see a Labrador 3-year-old fat dog spay, I will not sleep that night. It's important. It's not urgent, but I'm going to panic because to me, it increases my cortisol because of the procedure itself. So procedures increase the urgency and important as well. But if it's the only surgery I have all day and I have time to do it, my stress level goes down.
Hmm.
So we create this world of chaos, and the world of chaos is the urgent and important quadrant because then everybody's scurrying around without the ability to stop and focus and take a breath.
You know who does really good with expectations is airlines. They used to always be
Hmm.
late all the time. And then the government put in some rules somewhere about like if they're late, then they get fined or whatever, I think. I think that was the change. I don't hold me to that. And now everybody's like, your flight's this long, but you always land early. And then they say, and we're early or on time arrival. We've nailed it. Well, it's because they extended the actual time
Hmm.
frame of getting from Minneapolis you
Yeah.
know, to LA and threw in an extra half an hour, right?
Yeah.
But then they look great and the narrative's great and everybody's happy because people are like, wow, they got us here early. I'm excited about that, right?
Yeah.
So the airlines have figured out this expectation and important business and threw in a little extra in there in case there's mechanical failure. I mean, they don't nail it all the time, but they
Yeah.
got it down, right?
Yeah. That's a really
Restaurants
good
have done a better
example.
job of that as well, too.
Yeah. They buffer in, but adding that buffer time, I feel like is huge, which is a really good point.
Right. I mean, even if you're scheduled Beth, mid-morning, you throw in a half an hour in there just as buffer time, you'll probably eat it up every day, but your stress levels won't be as high.
So part of the training we need to look at for new doctors and for client service team is maybe if you have an ADR, ain't doing right coming in, it's not a 30-minute appointment for a new grad, it's a 40-minute,
Hmm.
and maybe a puppy is 20 minutes because a puppy is important but not urgent. How much of that can be delegated?
Right.
And it's harder to delegate the ADRs because you've got to communicate. Um, but if you can get that ADR hospitalized, you now have time because you don't have an extra level of pressure because pressure increases the speed that a clock goes.
Hmm.
So it's really thinking about, and this is part of what I try to teach a little bit, is to use 10-minute blocks for appointments where you can add 10 or subtract 10 to give extra time. If you have a Kelly bald cell client who's a real adrenal gland squeezer, with an adrenal gland patient that is an Addisonian, I need more time with Kelly just because of the person and the pet. On
Yeah.
the other hand, if I have a Phil Richmond who's total chill and he's just coming in for his annual visit with some boosters, that's 3 minutes in and out. I'll just smooth with Phil about life, and that's a buffer. That makes
Yeah.
so it's really looking at that to help them buy time, but it's also helping them to triage. And so it's practicing with them and asking them, okay, which quadrant does this case fit into?
Yeah. Yeah. And we try to build our schedule that way. Like it is mostly 20 and 30s, but then if it is something that needs an extended time, they'll push it out to 40. But it's so hot. I mean, you know how it is. Like most the best laid plans, right? Like you have this beautiful schedule where everything is pre-scheduled and there's like a medical, then a wellness, then a recheck, then another medical, and it's like beautiful. And then the wellness cancels, and now you have a hole, and then they put in it a 12-year-old dog that's newly seizing, and now you have 20 minutes to deal with this intense client with their really sick pet, and you're like, well, shit. And I feel like that's like the nature of veterinary medicine. And those are the situations that really lead to the spiraling into chaos because it's hard to like from a business standpoint, you want to fill that appointment. So is it better to leave it empty or to put something in it that you know is going to take more than 20 minutes? Like that's the thing, right? That you then end up dealing with on the fly. And I'm not the one making that decision. My front desk is the one making that decision based upon guidelines that they've been given, which sometimes they have enough information to schedule it right where it should go. And sometimes, whether it's because they don't have as much experience in triaging on the phone or because the client is presenting a totally different scenario than what's actually happening, that again, then you end up with this case being scheduled maybe where it'll be fine or maybe where now it's a dumpster fire.
It's an art
It is.
and a science. And by the way, for young doctors who might listen to this, or for Beth and for Kelly, if you talk to practices, one of the best time savers and time buyers are drop-offs
Yeah.
Mhm.
because the time in that exam room that's really needed by the doctor is about 3 to 5 minutes. The history, we can actually talk about time management from other parts of it, but the history and the follow-up care is where the extra time comes in. But
Hmm.
if I have a drop off and I can do a physical exam and maybe there's some history that's been collected, I can set up a treatment plan and get back to the client in a much more expeditious fashion. Plus, that block of time that was a no-show and now allows me to do some follow-up on cases that were dropped off or things of that nature. So for some of the cases with your young doctors, and I would actually suggest new hires, especially no any new hire or any experienced doctor who's coming into a new practice, the first month they just spend doing drop-offs and learning how
Yep.
the system works and learning where the how the cases are managed and things of that nature. It's kind of like a ramp up to the exam rooms, and it's really about giving them a runway to learn how things operate in your practice because no two practices are the same. So I know you're excited about this new part-time doctor that you have hired. It'll be interesting to see where her head is in the four quadrants.
Yeah. She's got some really good experience, so I feel like she so far, knock on wood, seems really good about kind of prioritizing. But we sort of did, for her first couple of weeks, I have her seeing hour-long appointments because I was like, I just want you to learn our flow, get to know the team, get to know how we do things, learn our system, and not feel rushed. So she has like really long, which is sort of a similar idea to doing drop-offs, is giving her like ample time to do that appointment and be able to do all the follow-up that goes along with that appointment without feeling like she has to jump right into the next thing while she's, not only learning our names and our team and our system, but also our clients. Like, I feel like that is a lot. She's at least not a new grad. She's got tons of great experience, but still, it's hard to come into a new place, even if you have experience.
So, Kelly,
Mm.
where is AI and websites and search fitting into your quadrants because it is totally disrupting your industry as well?
Depends on how you look at it, really. I was just had a I can't talk presentation this morning at a chamber event, a local chamber event, and they had a video person talking about AI in their business, which I thought was really interesting. It depends on how you use it, and the companies, the marketing companies, or any company really that AI touches that's going to survive are the ones that learn how to work with it and not think it's replacing you. So AI is probably, it to me is a new tool in my toolbox to give better service to my clients. And it's just another thing to navigate. I've seen so much change in my life with the internet come and go. I mean, I remember when social media hit, everybody was freaked out that that was going to be the thing that replaced everything else in life. And it just became a different part of life. It didn't become life, it just added to life, right? And the people who got really crabby with it and backed out of it, they chose not to adapt. Well, then they're not necessarily same here anymore. Does that make sense?
Mhm.
So I don't see it as a threat. I see it as, well, how can I make life even better using it? And knowing too, just like anything, it's not gospel. AI is not gospel. And I think some people, like I was just reading recently that some businesses who went whole hog on AI and cut their workforce drastically. This is sort of like when offshoring happened in the United States. Cut their workforce drastically, are realizing they are losing a ton of money because they cut too deep. AI isn't working. And who fixes the AI when the AI breaks, for example? And now they're having to hire back in. And those people they're hiring back in aren't as, like, they've lost all their institutional knowledge from the years, right? I mean, that's kind of a long answer, Peter, but personally, I may look at AI as an executive secretary, but if something's wrong with myself or my animal is a quick research tool, but I'm still going to come to a veterinarian to look at my animal, right? I still need to know the questions to ask in marketing to get the answer back. Garbage in, garbage out works really well with AI too.
Mhm.
So
Mm.
what you're saying is these companies that laid off people were living in the urgent important zone.
Yep,
They were reacting, creating chaos. And
yep,
what you're doing is you're living in quadrant two, which is it's important but not urgent. And
correct.
you're going to build up to it. That is the quadrant you want to live in. That is the homeostatic quadrant where everything is somewhat in balance.
Hmm.
It's when you are in quadrant one that your adrenals get squeezed. When you're in quadrant four, well, in a veterinary hospital, Beth, quadrant four is doctors cleaning cages. Okay. It's doing things that are not doctor work. And quadrant three is the step up from there where it's doctor work, but it really could be tech work. And that's when we can start to get our doctors to delegate, they can live in quadrant two, which is the really important stuff. Um, and so the ability to delegate to other people so it gets done by somebody else. It's urgent to somebody, but it's not urgent. It's not that important from a doctor standpoint.
Right.
So if we can live in quadrant two, which is not urgent but important,
Hmm.
our adrenal glands are okay. Living in quadrant four, burnout, substance abuse, compassion fatigue.
Yep.
Quadrant four, that was quadrant one. Quadrant four, we shouldn't even be thinking about. And quadrant three is really the one we have to work on, the ability to delegate. So we can focus in quadrant two. Delegate, delegate, delegate. And this is where young doctors do not have the skill set yet.
Yep.
And, Kelly, as you built your business, the ability to trust and train your team to the ability to delegate allows you to focus and live in the important but not urgent world where you're out there finding new business, navigating that. But then as soon as you've got the sale, you hand it off to somebody else, don't you?
Correct.
That's the thinking we have to look at. That's how you optimize your time.
Yep. Agreed.
And you have to be willing and be okay with yourself. I know, like, as some small businesses grow into bigger businesses, like think about a solo doctor and maybe one tech slash nurse who's also the front desk person, that as you grow, you're doing less doing in some of these other quadrants, and it may feel kind of threatening, like they can't do the job as well as I can, or they won't do it the way I want them to do it, or I don't know how to manage people, so they just do it always wrong. But I've never really stopped and talked to them or had a one-on-one with them. So how are they supposed to know? Is it like through brain osmosis or telepathic ability what their job is supposed to be? So to delegate, you also have to create the runway, which Beth, I've heard you say a lot of times you do have runways that you're delegating and how to teach people to delegate and have systems in place for delegations. And like, I don't think a lot of veterinary hospitals do what you do, listening to some of my clients and going to conventions and things. So you've got a lot of structure in place. Does it always need work? Always, because it's
Yeah.
humans involved. I mean, we
Right.
humans screw it up all the time, right? I mean, if there's going to be a screw up, there's going to be a human attached to it, right?
Yeah,
So,
that's likely. Yes.
mhm.
Yeah, I mean, it is something like I have learned, from my own trials and tribulations as a young vet and from practices I've worked at. You learn. You see what
Yeah,
works, you see what doesn't work. You see the situations that tend to cause stress, and then you learn from that and do it differently or do it better. And that's one of the things that we try really hard to provide for our younger associates and really all my entire team is the coaching that I think has to go hand in hand with how do you feel better about doing the same amount of work? Because that's what it's all about. Like, I don't want my team to be running in quadrant one all the time and going home exhausted and stressed and feeling like, ugh, like at the end of those days, you feel terrible. I want them in quadrant two, where they feel like they are helping a lot of people and their pets, but in a controlled, chaos, organized manner that at the end of the day, they feel successful, not exhausted. And I feel like that's the big difference of how to do that and help the same number of pets. Because you can help the same number of pets, and if you have proper processes in place, feel really good about it or feel totally exhausted and overwhelmed and burnt out. And it's like the same number, but it's all the delegation, the prioritization, the knowing what can wait, the knowing how to utilize your team, the knowing how to schedule properly. Like there's all these little things that go into what makes that day feel terrible versus feeling accomplished and like I really feel pretty good, even though that was a busy day. Like a lot of that. And then, the whole mindset thing comes into it. Like this topic could just spiral into 50 other topics, but that's the way it goes in vet med.
So let me ask a somewhat sarcastic but pointed question. Beth, what do you sell?
Ooh, what do I sell? I sell,
What does your hospital sell?
yeah, what does my hospital sell? We sell healthy pets.
Okay.
Long-term healthy pets, providing
How do
the
you get
tools to have long-term healthy pets
how do you get there?
by working together with the client, educating them, providing the tools and medicines and testing needed to gather the information to keep them healthy.
How do you do that?
By working with my clients and my team to help the client see the value of doing the things and spending the money to protect their pet or perform the testing or do the things that we're recommending.
What does it take to do that? What commodity?
Time.
Thank you.
Yeah.
So what are you selling?
Time, I
Thank
guess.
you.
Yeah.
No, it's exactly right.
Yeah.
And time is the greatest gift you can give someone because you can't get it back. So you
Yeah.
better get reimbursed for your time by using it appropriately. So you're selling your time. You went to vet school to be educated, and now is the time to get a return on your investment of education. You sell time. Time is the greatest value you can give to Kelly Baltzell as a client.
Yeah. It's true.
Mhm.
Should we drop Mike on that?
I
Yeah.
think we should. That was pretty good,
Yes.
actually.
I
Yeah.
think so too. Yeah.
Yeah. That's the vote there. So everybody, thank you
For your
for
time.
listening
Thank you for your
today.
time, for giving us
Yes.
your time to make yourself a better veterinarian and person.
And working on yourself. Yeah, I think
Yeah.
it's great. So follow us wherever you're finding us. We appreciate you all and adieu until, wait for it, next time.
It all comes back to time.
Time. Yeah.
Which is a four-letter word.